You don't have to live in pain anymore. This is the podcast where you'll learn the stories, tips, and tools to get back to your path to health. I'm Dr. Dudum, and this is Back at It with Dr. Decompression.
Hey, welcome. This is the Back at It podcast with Dr. Decompression. I'm Dr. Dudum. Today, episode 24, we're talking about centralization versus peripheralization. Super excited about this topic. Again, we'll give you some clinical pearls. We'll give you some stuff to do at home that will help. And I'll talk about stuff in the office that has also helped patients with what we're doing with centralization. Episode 24, I could not bring this episode to you without our sponsors, PillowWise USA. Amazing pillows, we talk about every time, and PowerPlate USA, the amazing vibration technology that helps our patients recover from herniated, extruded, bulging, all these types of disc injuries. So thank you to our sponsors. Let's jump into centralization. Now, what happens when you have a disc injury or any type of inflammation on a nerve is the pain in the back. Let's say the cause of the problem is the low back. Let's just say, for example, the L5-S1, you've got sciatica that's going into your calf. That is called peripheralization. The nerve is perforating, going to the outside or distal part of your body. The source of your pain is the L5-S1 disc herniation or extrusion. That's the source of your problem. The nerve is being irritated, and the nerve is inflamed, and you're getting pain into your calf. Centralization happens when you address the cause of the problem, the L5-S1, and you do different movements, and it helps the nerve heal from the L5-S1 nerve root, and the nerve pain centralizes or comes towards the calf, towards the knee, towards the hip, and into the back. So for example, if you're having sciatica and the pain is in your calf, centralization would be the calf pain is no longer there, and now the pain is in your hip and eventually your back, and it centralizes and it comes up towards the source. That is the phenomenon called centralization. I like to use the term also can be in congruence with centralization. It's called retracing. The nerve retraces back to the source of the problem, which is the L5-S1 disc herniation or extrusion or bulge, whatever the problem is. That's called retracing. So, and again, peripheralization is when it's the opposite of centralization. Peripheralization means it's going further away towards the periphery or the distal, which is your calf, your ankle, your big toe, your pinky toe. It's going further away from the source. That's peripheralization. Centralization is amazing. It's great. Peripheralization, not a good sign. So you want to do things that cause the pain to centralize towards the source. That's a sign of healing. So what are some signs of centralization? Besides the obvious of the pain traveling towards the low back. One sign of centralization is that it's coming from the calf and now it's into the knee and into the hip. It's coming up. Number two, the area, let's say your pain in your calf, all the way from the butt to the calf, is a 10 out of 10. It's the worst pain you've ever had, and you want to kick your leg, punch it, kick it through a door. By the way, I've had that pain. I had that pain 5 years ago. That's what led me towards spinal decompression. I had a herniated disc, L5-S1, 5 millimeters. And it was abutting and pressing against the nerve, and it was causing pain into my foot. So I've experienced that myself. And what happens, number two, the pain, instead of a 10 out of a 10, the volume, we'll talk about this every day in the office, the volume just goes down a little bit. Instead of a 10 out of 10, hey, Jerry, how's the pain today in your calf? You know what? Doc, it's still there, but it's like a 6. So it's a little bit less intense. That is a great sign of healing and a great sign of centralization. It means it's working. So for me, I knew it was working when my ankle was on fire, and I'm like, oh, it's there, but it's more faint. The volume is turned down. It's getting better. It still might be to the ankle. It's just less intense. That's a good sign. And then the other thing with centralization, a sign is a reduced patch. So let's say you have numbness into your foot, like you're a neuropathy patient, or you have just numbness in your foot. And let's say the patch, sorry for the listeners, but for the viewers on our YouTube channel, let's say the patch is this big. It's the size of a softball. Like example in the clinic would be, doc, yeah, I have this big patch on my foot that's numb. Okay. To monitor the progress, one thing to see if it's centralizing towards the source would be, hey, Susie, that patch that's a softball, is it still a softball? Or has it reduced to a tennis ball or a golf ball or a ping pong ball? Oh yeah, no, doc, it's still a 10 out of 10. It's super numb. Okay, but has the size reduced at all? Like, is it reducing in the size of the patch? Yeah, I mean, I think it's a ping pong, like it's hard to find, but when I find it, it's intense, but it's smaller. That's a great sign of centralization. The patch, the area of pain is reducing, and now it's a ping pong ball. Okay, so number one, does the pain travel up towards the source? It could, if you're having arm pain and numbness, it would go towards your neck if that's the cause of the problem. Again, I'm assuming that we've done these orthopedic tests and we've done imaging and that we know that the cause is the L5S1 or a disc herniation in your neck. We're assuming that. That's what we do in the office. That's how we figure these things out. So number one sign of centralization is it's retracing to the source. Okay. Number two is the intensity or that volume is turned down. So instead of a 10 out of 10, it's still the same distance to your calf or your ankle or your foot, but instead of a 7, it's a 5. And that's a good sign of healing that it's going to centralize. Number 3, the number 3 sign is the range or the patch or the size of the pain is reducing. Same intensity, but it's reducing in the area or the patch. I use that example of numbness with neuropathy in the foot as a softball, and it reduces to a ping pong ball. Same intensity, right? It's the same type of burning. It's just a way smaller patch. There is centralization occurring. And to combat that, again, just to touch on it, the opposite would be peripherization. It's going to the periphery. So when you're working with someone, you want to make sure that you're doing exercises or doing things that don't make the pain travel further down than they were doing, than the pain was. That would be a bad sign. Really small chance that could be good, but really, really small. Really small. So those are the different things. And now, when it comes to decompression, how do we, because the most common question I get with decompression, especially when someone comes to my office, is, God, everyone looks like they're just strapped in the same. Of all the 7 tables we have, most of the time, no one is the exact same angle. Rarely. And for sure, not one person has gotten the same exact treatment as another patient. It is completely individualized with their treatment. So, do you go L2, L3, L4, L5? Like, what angle do you do, and why is that going to be the best? Well, one of the testings that we'll do before we actually start the treatment is we angle the table and see what angle, what position helps centralize the pain. So, for example, if you had an L5S1 disc herniation, what we would do is we'd set you up and at L5S1, and we angle you a little bit, about 2.5 degrees based on our protocol. Hey, Jerry, does that make the calf pain less? No, it's referring more into my foot. Well, what I would want to do is not move forward with that angle. I'd want to try a different angle because I don't want it to peripherize, right? So then we would try a different angle based on testing, and maybe a 10-degree elevation. Jerry, does that feel better when you lay on your back? For the listeners, if you lay on your back and I angle your legs 10 degrees, let's just rest there for 30 seconds. How does that feel on your calf? Wow, I gotta be honest. I don't feel the calf at all. That's a good sign. That would be a position that we'd want to start decompression with. So you can't start decompression therapy based on images. You have to do testing to see what's going to get that nerve to centralize to the source and fix the problem. That is the protocol that we use, and that's why we're able to get such amazing results, because we don't just read the MRI and go based on the MRI. The MRI is super important. It's involved in the process, but it's not the only thing that we do to get the results. Let's talk about a patient example, and then I'll go into some exercises to possibly start centralizing your nerve pain at home. First patient, this is a crazy story. This is a patient that's currently in our program for decompression. He's 4 weeks in, intense lower back pain. I mean, he walks in the office, he is slanted. It's called an antalgic lean. He's slanted. His disc is angry. He has, this poor guy, he's had 3 spinal surgeries, disectomies and laminectomies, right? So the disectomies where they go in there and they kind of remove part of the disc that's on the nerve. And sometimes what can happen is part of the lamina or the bone, for the viewers, there's the disc. They would remove the disc, but what can happen is they might shave some of the lamina, which is here, that creates the hole to open up and create more of an opening for the nerve. I'm not a spinal surgeon. That's just how the process works. This poor guy's had 3 of those surgeries. He keeps relapsing on his disc. His disc keeps failing him with the surgeries. I think about 50% of the patients in my current program have already had spinal surgery. Yet they're in my decompression program trying to avoid a following surgery. About 50%. This guy, he was told, like, hey, there's no other solution. We have to do a spinal fusion. I don't know what else to do. Like, we have to fuse the bones and hope that that stabilizes the disc. That's the option. This guy said, there's no way I'm doing that. He's in his 30s. There's no way I'm doing that. He wants another option. He sees us. We do testing. I believe we can help him. Based on the MRI, based on the testing that we did, the angle, which caused centralization, I'm very confident we can help him. He's 4 weeks in. He's going through that centralization phenomenon. So what's happening is the pain was burning into his shin and into his heel. That's where his pain was. Back, antalgic lean, butt's on fire, legs on fire, heels on fire. 3 weeks in, actually 2 weeks into the process, hey, how you doing? How's your leg? You know what? God, I don't feel it in my ankle anymore. But man, oh man, my butt and my hamstring are on fire. Hey, that's great. He's like, what do you mean that's great? My hamstring, my butt are on fire. I said, yes, I know they're on fire. But how's your ankle? How is your shin? Doc, I don't feel it, but my butt's on fire, man. You are experiencing what's called centralization, okay? Or retracing. The nerve is healing at the source, and it's retracing and centralizing to the source of the problem. So guess what? Next week, your hamstring is not going to be, there's not going to be any pain, and there's going to be really sharp stabbing pain in your butt or your buttock. Sure enough, comes in week 3. Doc, you're right, man. My hamstring feels fine, but my butt, there's like a knife stabbing in my butt. I said, hey, man, that's great. And again, Doc, my butt hurts. I said, I know your butt hurts. The nerve's healing. I'm going to predict that next week, week 4, your butt will be pain-free and you'll get some soreness and achiness in your back as that nerve is healing. Watch. That's what's going to happen. Comes in last week, or comes in this week. This is week 4. Again, this guy was going to get spinal fusion 4 weeks ago. 4 weeks into treatment, he's like, Doc, I have no leg pain. I'm 80% better. My life is unbelievably better. He starts now on our power plate rehab program, and in 4 weeks, he's going to be 100% better. He has no leg pain, and his back is a little sore and kind of achier than it was, which makes sense because it's healing. That's how centralization works. The pain as the disc heals, the pain centralizes, and it actually becomes worse closer to the spine, and then eventually it heals. 80% better in 4 weeks after 3 failed spinal surgeries. That's what decompression can do, and that's why the key to this is finding out what angle centralizes the pain, and that's the angle that you should go with. That's how we utilize the experience of spinal decompression. Let's talk about these exercises you can do at home. So, hey, what can I do? I'm having leg pain. What can I do now to try to help? You want to find a position that helps bring, if you're having, let's say you're having burning calf pain, you want to find a position that helps reduce the calf pain and creates more pain upwards towards the spine. That would be centralization. McKenzie protocol is a great protocol that helps this premise of centralization. Typically what you do, again, for the listeners, I'll describe it as best as possible, but for the viewers, you'll see we'll add some B-roll on them. Number one, if you're having some lower back pain and you're having pain in the calf, I'd lay on your stomach on the ground, and I would slowly put your hands in front of you, in front of your chin, and I would slowly look up like 2 inches. Hold that. Hold it for 30 seconds. See if the pain in your calf goes away and it starts to become more prominent in your hamstring or your butt or your back. Again, if it's making the pain worse in the calf or goes further down, stop the exercise, not the position for you. If it feels better, then what you can do is you can push up a little bit like a mini cobra, and you can create more arch in your back and see if it improves even more. You'd want to do this and hold for 10 to 20 seconds a few times a day. If that angle is helping, start doing it more and start angling more like a deeper cobra. Push down more. That will help centralize. Again, if it's improving, keep doing it. You know, there's a quote, I love this quote. Albert Einstein, the definition of insanity is doing the same thing over and over and expecting different results. If it's not working, do something different. So if you're pushing and it's making it worse, that's not the position for you. Do something different. What I would do if that stomach extension doesn't feel great, I would flip it over. I'd lay on your back and I would gently bring your knees to your chest and rock a little bit back and forth and back up and down. See if that gives you a little bit of relief. Again, if it makes it peripheralize or distally towards your foot, stop the exercise. If it feels better and it centralizes, like, yeah, now like my calf feels a little better, but my butt hurts, that's good. It's a good thing. Try those exercises. The 2 different types. One's a flexion-based exercise, like knees to chest. The other is an extension-based. It all depends on if you have a disc injury. What type of disc injury? Is it a disc extrusion? Is it a disc protrusion? Is it a disc herniation? Is it a sequestrum? Like, there's a lot of things that could be going on. So without doing an exam, try those. If it makes it worse, stop doing them. Might not be the right exercise based on your condition, but a great place to start. A great place to start. The key, though, wrapping up this pod, the key is to get everything towards the center and the source of your problem, to centralize the source and the pain. If it's centralizing, even as we're going through care, through decomp, if it's starting to creep up towards the spine, that's great. We're on the right track. We just got to keep doing the right things. Kind of brings us back to last episode where we talked about the ebbs and flows of healing. If it's working, then it's not. As long as you're seeing steady improvement, you're on the right track, guys. Keep consistent. It's when it's not working that you have to change something and make a modification. That is centralization. And that's the phenomenon of healing nerve pain down your leg or into your arm. Hey, if you guys like this podcast and you like this kind of information and it's helpful for you, or you know someone that's suffering, can you subscribe to the podcast? I'd love to get some comments as well about future topics on what you would like to hear about. A big thanks to our sponsor. You can subscribe to us, on YouTube. We are on Apple and also Spotify. Don't forget to subscribe and press the like button if you are into this material and it's helping. Again, thank you to our sponsors. They help support the podcast and bring this information to you. Don't forget to check them out as well. We have Pillowise USA and PowerPlate USA. So thank you to them. And I'm looking forward to episode number 25. We have a guest speaker that's going to be talking some clinical info on episode 25. So don't forget to subscribe so you can catch on when we are going to be releasing that, okay? Thank you to everyone that's listening. This is the Back at It with Dr. Decompression. I'm Dr. Dudum. Thanks.